Hello, this is Jeremiah Gibson with Fast. I'm so delighted to be joined today by Corky Becker. Corky is a family therapist and clinical psychologist who works pretty closely with the Therapy Training Boston in Watertown. Corky is overseeing and running the monthly master series in couples therapy that's starting. Corky, when is that starting again?
November. So
November.
the first session is November 6th, and it runs on the first Wednesday evening of the month, starting November through May.
Excellent, excellent. Fast is dedicated to providing quality continuing education around couples therapy and family therapy. And this program is definitely top notch. And I wanted to take a few minutes to talk with Corky this morning about that program. So Corky, thank you so much for joining me this morning.
It's my pleasure.
So Corky, tell us a little bit more about the monthly master series in couples therapy. What's the format of it? Let's start there.
Well, I think the design is really special. I've invited 7 different outstanding presenters and therapists who have different ways of thinking about couple work, different ways to focus their work, different personalities, but all excellent presenters and wonderful interviewers. And the format is that people, this class starts at 6:45, goes to 9:30, and the first half hour, 40 minutes, is the presenter talking about what their way of thinking about couples is. And then for about 45 minutes, they interview a role play couple played by people from the class. Yeah. Who are carefully instructed and enrolled to be authentic. And we watch the interview, which is just a rare opportunity to see people in action. Yeah. And then afterwards, we have time to really unpack and understand and discuss the therapist's actions and the experience of the participants in the role play from their perspective, what the turning points were and how they were influenced by the things that the therapist did. And then we open it up for discussion to the group. And we create an environment, a culture of support, appreciation, and respect in which everybody's voice is welcome, and we create a space in which everybody will speak in a way that everybody can be heard, include all the audience, the whole participants included. And then there's usually at the end an exercise or an activity that the presenter brings to give people an experiential activity that highlights some aspect of what they were discussing.
Good. Who are some of the speakers that are presenting with you, and what are some of the models that folks can learn about?
So this year, we have people who are discussing things that vary quite a bit. Robin Deutsch is the first presenter, and she runs the Center for Excellence at what's now the William James University. Yeah. And the title of her presentation is Conducting a Co-Parent Meeting in a Case Where a Child Resists Contact with a Parent. These are very challenging cases, and she's an absolutely superb interviewer. And she's going to be talking about apology and repair. And that's November 6th. Mm-hmm. December 4th, I'm going to be leading off. My specialty is working with conflict in couple therapy, and also about how do people acknowledge and take responsibility for their actions with each other. Yeah. And ruptures and repairs. Next in January 8th, is Alana Katz. She's from the Ackerman Institute. She has a background in mediation and emotionally focused couples therapy, which is related to creating secure attachment between couples. Yeah. And she teaches all over the world and the country. She works at the Ackerman Institute. At February 5th Anne Fischel is coming. She is the director of family and couple therapy at Mass General Hospital. She's the training. And she has written a book on the life cycle, heavily researched book on the life cycle of the couple, from dating to death. And has really a way of taking that research and framing questions that can be asked of couples related to the research. It's very, very helpful. And then March 4th is Ellen Safier. She's in Texas. She's a social worker who teaches psychiatrists and psychologists and social workers couple therapy and family therapy. And her specialty is mentalization-based couple therapy, which is Peter Fonagy's psychoanalytic term for what goes into secure attachment, which is the capacity to hold your own mind in mind and somebody else's mind in mind. And so her couple therapy is very organized around mentalization therapy. And Martha Edwards, April 8th, is at the Ackerman Institute, and she's going to demonstrate using experiential strategies in the room to get people to be more connected. She also has started a program called Bright Horizons, which is a program for mothers with new babies and getting them off to the right start. She's a beautiful presenter. And finally, May 6th, Mona Fishbane, who's written a lot about the vulnerability cycle and neuroscience. And she integrates neuroscience, couple impasses, and family of origin work. Yeah. She's also a beautiful presenter. So it's an amazing group of presenters. And I would say that if I had to say the similarities, I would say everybody's talking about connection, disconnection, rupture, repair. Yeah. And probably the differences are personal styles and personal interests.
Yeah. Where can people learn more about the monthly master series?
So go on the website, www.therapytrainingboston.org. And when you get on the website, you can press training. And under training, you will find the master's series. And then under that, it will say learn more. You press that and you get a very long description of each person's presentation and their biography. So it's very complete.
Excellent. What information about couples therapy do you expect participants to know prior to week one? Is this an intro to couples therapy course, or is this more kind of intermediate, advanced based stuff?
I think that people come in at all different levels.
Okay.
For people who are beginners, I would say that it gives them a picture of the shift from individual to relational work, where the focus in individual therapy is on each person and in couple therapy is on the interaction and the relationship between people.
Sure.
So it's a really good start for people to look at that shift.
Yeah.
And for very experienced couple therapists, it's a great way to see 7 different people's approaches to interviewing and expanding the possibilities for the kinds of questions you can ask and the ways you can work in the room. Really, it frees you up to think, oh, I could do that. I could do that. You know, that's really interesting.
Sure.
So I would say anybody can take it and you'll get something different out of it.
Yeah, that's great. And you were mentioning in the process of each week that there's room for dialogue, not just between the presenter and the participants, but also dialogue between the participants as you all work through a role play. How have you seen the group also provide education for other people within the group?
Well, I think everybody is involved in a very warm, supportive, appreciative environment and culture, so people can take a risk to talk about what bothers them or what they observed in relation to the couple therapy or questions that it brings up for their own couple work. And it's not supervision, so you know those comments are really a takeoff point for certain kinds of problems rather than the particular couple that somebody's seeing.
Yeah.
But there's a lot of time for discussion.
Yeah, that's great. What information and skills do you expect participants to leave with following the final meeting in May?
Well, I think that people will come away with the idea that a couple problem is perpetuated by a sequence of interaction in the present, which is driven by family of origin experience, attachment needs, and maintained by each person's using their defenses or their protectors, which in turn keep the problem interaction going. I think the other thing is that people will see that there are many ways that people can use themselves as a as a couple therapist.
Yeah.
To work with people.
So this is the 6th year that you've been doing the monthly master series. Congratulations, first of all. That's a big accomplishment.
Yeah, no, it's very popular. Thank you.
Yeah. How have the first 5 years shaped the way that you've created this year's series?
Well, I think that I've gotten more informal
Okay.
about the structure and allowed the presenter to have a little more time to present, to interview as long as the interview goes,
Yeah.
and to allow for a lot of questions and participation on part of the audience, which is the trainees. And I think I can be more flexible as I've gotten more comfortable with the format about how to keep on track without having a very rigid structure and format.
Sure.
Other than that, I think we just hit on a really great structure.
Yeah.
And it really works well.
That's great. You mentioned that part of that structure is the experiential learning component. And I'm curious, just if you could talk a little bit more about what someone can expect as they're participating and watching the role play. Role plays definitely bring up anxieties for therapists, particularly therapists that are new to the type of therapy that we're talking about. So I'm curious if you could talk a little bit more about what participants can expect during the experiential exercises.
We set a frame that's like, this is a performance, so no giggling.
Okay.
And respect, and really hold your reactions till later.
Mm-hmm.
So during the actual observed interview, there's no room for interruption. And then we have a very specific sequence for deconstructing what happened, which includes talking first to the therapist and their intentions, and then de-rolling the couple and finding out, what was important to them. And then we open it up. And then that's the time when people can talk about their own experience, their own perspective, their own questions, their own, well, I would have done this, and why did you do that? And those kinds of things.
So it's kind of a parallel process for the couples therapy process. You're enacting in the experiential setting what a couple therapy session might also look like. A couple gives you a dynamic. You pause. You give them a little bit of space to let the dynamic play out. You pause. You reflect on what happened. You give each partner the chance to provide their own feedback to it.
Yeah, I mean, I'm interviewing the couple again about their experience in the role, and asking them to look inside and say, when did you notice something changed for you, and can you relate it to something that the therapist actually did or said? What were the moments of transition or transformation or shift for you, which not everybody can do. It's pretty hard.
Sure.
But people do it by and large. And that's really interesting information, I think, for the therapist and for the group and for the participants in the role play.
Yeah, definitely. What are some things that you're hoping happens differently in year 6 of the monthly master series?
So I don't really have a particular hope that things will go differently. Mm-hmm. I think we'd like to make a little bit more room for people to share some of what they're struggling with in doing their work at home. One suggestion was that we start a little earlier with 15 minutes for people to sort of check in and say what it was about the previous meeting that stayed with them or that they've been chewing on and wondering about. But we don't want to derail the focus from the present presenter. So it's going to be a matter of trying to take a little bit of space for people to check in and be feeling like a group. That might be a shift.
Yeah, great. You've mentioned, Corky, the experiential learning element of couples therapy, and I think that's brilliant. You learn couples therapy by doing couples therapy and by talking about it, by processing it alongside of learning the theories of it. I'm also curious about a comment you made earlier. This isn't supervision, and I'm curious what the difference between kind of your model and supervision is, and more importantly, how you encourage the participants to seek kind of ongoing training and support and consultation.
Well, the reason it's not supervision is because it's a tightly structured, time together. It's 2 hours and a half, and there really isn't time to do supervision. And people may want to consult about a question, but it can't really be about that case.
Sure.
So, people can bring up a kind of issue or a kind of question, but not really get into the supervision of that particular couple that they're seeing.
Yeah.
But, there are opportunities for supervision. In 1 year, I offered an opportunity once a month for people who wished to practice. And Liz and I both offer supervision groups. If people were to initiate something, they could get supervision through Therapy Training Boston.
That's great.
But it's really not oriented toward their cases. It's really oriented toward learning from what you see other people do.
Sure. Yeah, I think that's an important clarification to make. And I'm also curious to learn more about the supervision groups that you and Liz Brenner run through Therapy Training Boston.
Well, Liz would speak for herself. I know she has sometimes got openings, and they're listed on the website, her groups.
Okay.
I have a couple of supervision groups. Also, they're not listed on the website, but I have 2 Monday morning groups for people doing couple therapy.
Yeah, that's wonderful. As just speaking for myself in my own development as a couples therapist, supervision has been an extremely important part of my growth and development.
Yeah. We all need to talk about our cases. There is no doubt about that. We need help because you get very sucked into a couple and you lose perspective, and you need an outside perspective.
Sure. Yeah, and it's good to know that that's offered at Therapy Training Boston. You on the website mentioned that NEFS members can receive a discounted rate. Curious just to learn more about the cost of the monthly master series and more about the NEFS discount.
Well, it's $750. It's $725 if you come with a group, and it's $700 if you're an NEFS member. And if you contact Liz at therapytrainingboston.com, she would give people a code to use to access that rate.
Perfect. That sounds great. Last question. I'm curious particularly for those that are newer to couples therapy, what are 3 tips that you'd like to share for those therapists?
Well, I thought about this question. So I thought one tip is stay in the charge of the session. Be clear about your goals, purposes during the interview, and create an environment in which people are welcome to participate within the boundaries of your direction and guidelines. That's number 1.
Right.
Number 2, view the couple relationship as the focus of the work, while at the same time being interested in the experience of both partners and their contribution to the interactions between them. And 3, remember that change occurs in the context of a positive connotation. Keep in mind the positive intentions, hopes, and goals of the couple, and view their problem interaction as their way of protecting themselves, and consider taking into account their history and current context, and figuring out how else they can feel safe with each other and with you and reach their couple goals.
Yeah, those are excellent tips. And
Thanks.
yeah, and also just as you were saying that, those tips, I was reminded of just how difficult couples therapy can be, and all the things that you're watching, all the things that you're looking for. And I think that you've summarized those really nicely in the tips that you've mentioned.
Thanks. I think that couple therapy is the most interesting therapy that I've ever done.
Yeah. What is interesting?
Because it's interesting because people are struggling to make a connection, and there are a lot of things that people have learned that they need to unlearn, or skills they need to learn in order to make that meaningful connection. So there's a lot of forces for disconnection and desire for connection.
Yeah.
And people need to unlearn what they've learned to protect themselves and learn new skills in order to find a way toward each other.
Yeah.
And that's really interesting. And I think the other thing that makes it really interesting is that the work is between the couple. There's less emphasis on the therapist's relationship to each person, and more facilitating of the relationship between the couple. So it takes the therapist into a more, what Michael White calls, a decentered position. And I think finding a way to be influential and decentered is really interesting.
I'm curious how the monthly master series in couples therapy addresses self of therapist throughout the training.
Well, I think that the self of therapist, first of all, is really evident in the demonstrations. You see 7 people work very differently. How they use their own natural abilities, their own intelligence, their own theories, their own ways of connecting, how they use elements of surprise or information or knowledge, how they frame things, all differs. And it's very exciting to see that people can be themselves and can be very different and still be effective. So I think it's primarily through watching these very skilled therapists do the work that the self of the therapist is important. And I think that by example frees everybody up to find their own way, their own style.
So monthly master series in couples therapy, starting in November, first Wednesday of the month, essentially.
Yes, first Wednesday of the month, essentially. Not January 2nd or whatever that first Wednesday is, but mostly. Yeah.
And again, for more information, therapytrainingboston.org. Thank you so much for joining me today, Corky. I hope that you have a good rest of the day.
Okay, thanks so much.